Okay, so to begin our exam for Parkinson's disease, we will begin by inspecting the patient. Some things to look out for are reduction in spontaneous movements. So this includes decreased blinking, decreased hand gestures while they're talking. Another thing to be mindful of is frequent crossing and uncrossing of the legs, as this could indicate dyskinesia. And then lastly, we want to assess our patient for any resting tremor. Typically, this is unilateral, and patients get pretty good at concealing a resting tremor, so be mindful of their hand position. Like you can see right now, he's got them clasped together, which could be concealing a tremor. So we'll begin by assessing for bradykinesia. Bradykinesia is required to make a diagnosis of Parkinson's disease, and then we need either rigidity, a tremor, or gait imbalance or postural issues as well. So for bradykinesia, we'll have the patient do a repetitive motion. We'll have him touch his pointer finger to his thumb. We can show the patient how to do that. And we'll ask the patient to do it as big and as fast as possible, because in Parkinson's, over time, we'll see a reduction in the amplitude and the speed. In a normal patient, the movement will remain consistent. We'll then ask the patient to repeat the movement on the opposite hand. Again, thumb to forefinger there. And then we can look for bradykinesia in the lower extremities by asking the patient to tap the sole of their foot as big and as fast as possible, watching for at least 10 seconds, again looking for reductions in amplitude and speed, asking the patient to repeat this then on the opposite leg as well. The second thing we'll assess for is rigidity. So rigidity in Parkinson's is not velocity dependent or direction dependent. We'll grab kind of under the elbow here and rotate the arm in both directions. Sometimes in Parkinson's disease, you need the patient to do an activating movement to catch the rigidity. So we'll ask the patient to tap their knee with the opposite hand quickly and assess for rigidity that way. And you may catch it's a little more stiff. And then we'll also look for this in the wrists, rotating here in both directions, having the patient continue that activating movement. We could then repeat this on the other side, and then again, we will look for rigidity in both of the lower extremities. It's a little bit more challenging to assess on the lower extremities, but you can grab behind the knee here and go in both directions. Again, you may not notice it without that activating movement, so we'll have the patient repeat that. And then we would look on the other side as well, and also in the ankle joint. Following looking for rigidity, we will assess the patient for any tremors. So we'll have the patient rest his hands on his thighs with his thumbs facing the ceiling, because in that position, you really can't conceal any sort of resting tremor. Again, resting tremor is usually unilateral in patients with Parkinson's. The other test we'll do to assess for tremor is to have the patient put their hands in the pronator position and assess for any tremor this way. In a normal patient, you won't see a tremor. In a patient with an essential tremor and not a Parkinsonian tremor, you'll see them tremor in this position. And then the last way we can assess for a tremor is an action tremor. So having the patient take their pointer finger to their nose and then touch your finger and repeat with the other side, making sure the patient's arm is fully extended. And again, if they tremor in this position, it's likely an essential tremor and not a Parkinsonian tremor. The last part of our assessment here for Parkinson's disease is to assess gait imbalances and postural reflexes. So the first way we'll do that is ask the patient to stand up, having their arms across their chest so they can't use those for help with balance. If the patient is able to do that, you can move forward with the rest of the balance exam. You can actually stand back up. And then we'll do the Romberg exam by having the patient place their feet together and close their eyes. The patient should be able to stay balanced like this. But in patients with Parkinson's, you may see that they're not able to stay upright. They may need to take some steps to keep their balance. If they pass the Romberg test, then you can move forward with the pull-push test, which tests the postural reflex by having the patient close their eyes. Ideally, you would have a wall behind you in case they were to fall back, and you could pull the patient back towards you, and they should be able to regain their balance in a step or two if they are healthy. But in Parkinson's disease, you may not see that, which again is why it's important to have the wall behind you. And then the last thing we'll assess for is observing their gait. So we'll have the patient walk and then turn around and come back towards me. We're looking for the symmetry of their steps, how their heel is striking the ground, and then the swing of their arms. In patients with Parkinson's, you may see a decreased arm swing or more of a shuffle in their gait.